are very confident, and they know exactly how to proceed, and they're able to get that testing done because they have all of the capacity, all of the PPE, they have trained staff, and they have a relationship with a private lab that's able to get that testing done. And the same can be said for larger hospitals, while other providers really need the assistance of public health to come out and do the testing, or to have their patients referred to us here at the health department. And then we basically can run those tests on their behalf with our new lab that's now set up at Fresno State, or with our relationship that we have with one of the private labs. So it just really depends on what the individual situation is. We really just try to promote very logical testing, evidence-based testing that's based on the latest guidelines from our state and CDC authorities. But at the same time, we want to give people answers as quickly as possible. So we do try to be sensitive to those issues. And sometimes we prefer to get people tested here on our own department, and then get that run in-house. Or if we feel confident that a medical facility or a hospital is able to get that testing done, and that they can do their own in-house laboratory testing in an expeditious fashion, then we would certainly be amenable to having that lab run the test. So it really just depends. Like I said, we really want to work with all of our medical providers and give them the fastest, easiest method of getting this testing done, because we think that that's what's going to be best for our patients. So over the weekend, I think I explained this on our Friday call, we were working on an advisory, which really is just a way for us to communicate with our medical providers. And this advisory was really about congregate settings. And we really wanted to let everyone know that we're very focused and concerned, and we wanted to share some of our recommendations for best practices related to congregate settings. I explained a little bit about what we mean by congregate settings, and that's really just anywhere where a lot of people are housed together, and where a contagious illness like the COVID-19 could really cause an outbreak. So that could mean a nursing home, that could mean like a homeless accommodation or a shelter. It could mean our incarcerated populations. And so all of those are considered congregate settings, and all of those are places where the staff, as well as the folks that are staying there, could pass on this COVID infection if it was introduced to those settings. So we felt like it was really important to make sure that all of those settings have the support that they need to screen, diagnose, and contain a case of COVID infection before it becomes an actual outbreak. So our health advisory is actually asking all of those congregate settings to take some steps if they haven't already done it. I have to say, I'm very proud of all of the congregate settings in our county, because I feel like they are already taking a lot of steps to keep their residents and their employees safe. And everyone that we're working with has really risen to the occasion which this pandemic presents, with all of its different challenges, et cetera. The testing piece is something that has been changing, and what we're recommending is that really anyone who is entering those congregate settings should go ahead and get tested. And while they're waiting for that test to come back, that they be placed in for what we call a warm zone, which means that they would be separated from the general population in any congregate living or social areas or common areas, and they would actually be kept in that isolation zone until their test comes back negative. And obviously, if their test comes back positive, they would have a place to stay where that viral infection would not be passed on to staff or to other residents of that setting. As you can imagine, these settings can sometimes have a dozen folks, sometimes they can have hundreds of folks. They all have a different physical layout, and so they therefore require different containment strategies. Physically, the way that people are interacting with the staff as well as with the residents, even down to the level of exactly how the paperwork and things like the booking process in the prison are done, et cetera. So all of those congregate settings are already working on those issues with our support and with our guidance. And what we're asking now is that they take that extra step to make sure that they're screening all of the people that will end up going there to make sure that they don't have the COVID infection, or if they do, that they have a separate area where they can be housed during the time of their stay. We're